Understanding autism causes, symptoms, and treatment. Hello and welcome to Hwyet Media, where healing and understanding come together. In today's episode, we'll explore one of the most discussed and often misunderstood conditions in mental health, Autism Spectrum Disorder, or ASD. What exactly is autism? What causes it? How does it affect children and adults? And most importantly, what kind of support helps people with autism live healthy, fulfilling lives? Let's begin. Autism spectrum disorder is a neurodevelopmental condition that affects how a person communicates, interacts, and behaves, according to the Diagnostic and Statistical Manual of Mental Disorders. 5th edition DSM-5. Autism is defined as a persistent pattern of difficulties in social communication and social interaction, combined with restricted and repetitive behaviors, interests, or activities. The term spectrum means that autism presents itself in many different ways and levels of severity, from mild to profound, because no two individuals with autism are exactly the same. In simpler terms, autism influences how a person perceives and connects with the world. Some individuals may have challenges in understanding social cues, expressing emotions, or maintaining eye contact, while others may show deep focus on specific interests or routines. It's not a disease or something that needs to be cured. It's a different way of processing information and interacting with the environment. As the World Health Organization 2023 reports, about 1 in every 100 children worldwide is on the autism spectrum. Though rates can be higher in some regions due to greater awareness and improved diagnosis, autism usually becomes noticeable in the first 3 years of life, though signs can appear earlier. Some children may not develop language as expected, while others may speak but struggle to use words in social contexts. Parents often notice that their child prefers to play alone, avoids eye contact, or becomes upset when routines change. These early behaviors form part of the social and communication differences described in the DSM-5. Now, let's talk about the causes of autism. Scientists agree that there isn't a single cause of autism. Instead, it results from a combination of genetic and environmental factors that influence brain development. Studies of twins and families show that autism is highly heritable. Between 60 to 90% of cases are linked to genetic influence. Researchers have identified several genes involved in brain growth and communication, such as SHAD8, SHANK3, NRXN1, and SCN2A. These genes affect how neurons connect and communicate, which can influence behavior and learning patterns. Besides genetics, environmental and biological factors also play a role. Advanced parental age at conception, complications during pregnancy, exposure to air pollution, infections, or certain medications have all been linked to increased risk. Maternal stress, malnutrition, or metabolic conditions during pregnancy can also affect fetal brain development. However, it's crucial to emphasize, and this has been proven again and again, that vaccines do not cause autism. A large-scale meta-analysis by Taylor and colleagues in 2019 concluded that there is no scientific evidence linking vaccination to autism. When it comes to symptoms and diagnosis, the DSM-5 outlines two main categories. The first includes deficits in social communication and interaction. This means difficulties in engaging in back-and-forth conversation, understanding emotions, or forming relationships. For example, a child might not respond when their name is called, avoid eye contact, or have trouble understanding social boundaries. The second category involves restricted and repetitive patterns of behavior, interests, or activities. These can appear as repetitive movements like hand flapping, repeating certain phrases, strict adherence to routines, or intense interest in specific topics such as numbers, trains, or colors. Some individuals may also have sensory sensitivities. They may be overly sensitive to sounds, lights, textures, or smells. Autism is often diagnosed by observing behavior, developmental history, and communication skills. There's no single medical test for autism, but screening tools and expert assessments help determine whether an individual meets the DSM-5 criteria. Early diagnosis is vital because it opens the door to timely support and intervention, which greatly improves outcomes. Now, let's explore treatment and support strategies. While there's no cure for autism, there are many effective ways to help people on the spectrum thrive. The most widely used approach is applied behavior analysis (ABA), which uses positive reinforcement to improve social, communication, and learning skills. ABA has been shown in numerous studies, including Smith and Iodarola 2022, to produce meaningful improvements, especially when started early in childhood. Other evidence-based interventions include speech and language therapy, which helps individuals develop communication skills, whether through spoken language, gestures, or assistive devices. Occupational therapy helps improve motor coordination, sensory processing, and daily living skills. Educational programs such as Teach and Dear Floor Time focus on creating structured, engaging environments that respect the individual's learning style and emotional needs. Medication can sometimes be used to manage symptoms like irritability, hyperactivity, or anxiety, though it doesn't treat autism itself. Cognitive behavioral therapy, CBT, has also been found effective for high-functioning individuals in managing emotional challenges and improving coping strategies. Equally important is family and community support. Families play a central role in helping individuals with autism adapt and grow. Parent training programs, support groups, and inclusive educational environments can make a powerful difference. As Ventevagel 2021 explains, empowering families with knowledge and coping strategies reduces stress and builds confidence, ensuring that care for autistic individuals is consistent at home, school, and in the community. Recent studies, Joe et al. 2022, Miller et al. 2023, highlight that early holistic interventions, combining behavioral therapy, speech therapy, sensory integration, And emotional support can lead to remarkable progress in communication, social interaction, and independence. The key is to understand autism not as a deficit, but as a unique way of being. Each individual has strengths that can flourish with the right guidance and empathy. In summary, autism is a lifelong neurodevelopmental condition that shapes how people experience the world. It arises from a blend of genetic and environmental influences and is defined by challenges in communication, social interaction, and flexible behavior patterns. But with early diagnosis, evidence-based therapy, and strong family support, individuals with autism can live rich, meaningful lives. So, if you know a child, a student, or even an adult who shows traits of autism, remember, understanding is the first step toward inclusion. Offer patience, compassion, and encouragement. Because with the right support, every person on the spectrum can thrive in their own way. Thank you for watching Hwyet Media. Our mission is to bring healing and awareness to minds and hearts. Stay with us for more educational and inspiring content on mental well-being. Don't forget to like, share, and subscribe, because healing begins with understanding.